We just want okay. Let's all close our eyes as we pray. Thank you, Jesus, for the joy of this new day. Thank you, Jesus, for all our speakers. Thank you, Jesus, for everybody present. We pray, Lord, that their words will make an impact with us and leave us with something to hold and something to use to better ourselves in future. In Jesus' name, amen. Amen. Thank you all very much. So, yeah, soft skill webinar. It's been a long time coming. There's been so much anticipation, and I'm really, anticipating actually. And I'm here with my co-host, Mustafa. Mustafa, please introduce yourself.
Hello, everyone. It's an absolute pleasure. It's a joy and an honor to be amongst everyone here. My name is Mustafa Madain. I'm a 300, sometimes I say 400, dental student, product of a member of ULADS, University of the Association of Dental Students, and it's an absolute pleasure to be amongst you all. And yes, we'll be talking about soft skills today. What are soft skills? Soft skills are regarded commonly as common skills, as the core skills that cut across all forms of professions. Whatever profession you are in, soft skills are important for you. Research from Harvard University and the Carnegie Center actually says that 85% of job success actually comes from people who hone and perfectly display soft skills, while 15% of success comes from those who actually have the technical and actual hard skills. So yeah, it's just amazing to see what we would get from today's webinar. And yeah, it's an absolute pleasure to have everyone here. Can't wait to see whether being paid according to the content we've seen, whether being paid or Makanaki, how best they could have handled their situation. So yes, absolute pleasure. Over to you, Eniola.
Okay, thank you so much, Mustafa. So we are very honored to have in our midst veteran speakers in this aspect of soft skills. We have Mrs. Peace Fabunmi and our very own doctor from dental school, Dr. Umeh. So you're welcome, Maz. So our first speaker is going to be Mrs. Peace Fabunmi. I'm going to give you a brief introduction, and then she's going to tell us what she has for us today. So Mrs. Peace Fabunmi is a resourceful, detail-oriented, result-oriented, and highly motivated trainer with experience impacting the lives of diverse professionals by crafting and delivering training to suit the need of the organization and fill their training and skill gaps. Her training experience spans training Nigerian youth on the relevance of soft skills and how they can harness the skills and make a difference both in their personal and professional lives. She has trained healthcare professionals
Yes, Mrs. Fabunmi has trained healthcare professionals, doctors, nurses, and pharmacists on the use of specific drugs while working as a medical representative. She has also trained individuals and the public on public and environmental health while working with the Kaduna State government. Generally, she develops and trains individuals using various pedagogical approaches to suit different learners. She's also a trained virtual exchange facilitator and coach, certified by United Nations Habitat. She's an expert at creating a safe space for dialogues to happen, asking critical thinking questions that enable participants to deep dive into dialogues and helping them learn through difference. She has been actively volunteering since the fall 2020 semester in a cross-cultural education program integrated into existing post-secondary curricula in more than 200 universities across 35 nations as a facilitator with Solia, providing a deeper understanding of the perspectives of others on important socio-political issues and crucial 21st century skills, including critical thinking, communication, and digital media literacy. Come on, please, let's jointly give it up as we welcome Mrs. Fabunmi to the virtual stage. Mrs. Fabunmi, please take it. Please let us give her a warm round of applause, please. We can do this. Come on. Yes, exactly.
Thank you, Mustafa. Thank you. Mustafa literally read my profile on LinkedIn word for word. All right. Thank you, guys. Good evening. Good evening. Good evening. How are we all doing? So I'll start by, okay, that's good to know. I'll start by appreciating you, Mustafa, Stephanie, Eunice, and the entire University of Lagos Association of Dental Students, right, for putting this up, for planning. And for me, I'm privileged and I'm honored to be here at this time facilitating this conversation on soft skills. So I hope you enjoy the training and you'll pick up at least 1 or 2 skills that will be useful in your individual lives, both as a professional, as a dentist, and then even with relating with one another. So we'll do a round of intros, right? I understand we are on strike, like ASU is on strike and participants are connected from all over the world. Some of you are flexing in Dubai on holidays. Some of you are currently in Canada, in America. So just type in the chat box, tell us your name and where you're logging in from. What else? You can tell us your level. Are you in 500 level? Are you a fresher? Are you in 100 level? So I'll start. I'll type my name, Peace, Lagos, Nigeria. Okay, Tosin is in Lagos, is in 500 level. Welcome, Tosin. Welcome, Eunice. Eunice is also in Lagos. I think we are more of Lagosians in this group. Who else is here? Funshaw is in Lagos. Mustafa is also in Lagos. He's not sure he's in 300 level or 400 level. Which way now, Mustafa? Who is that? Okay. Abiola is in 400 level. He's connecting from Ibadan. Nice to meet you all. Thanks for joining. Adeyi is in 600 level. Adeyi is almost graduating. Welcome, Adeyi. Okay. Irada is in 200 level. I hope I pronounced your name well. Welcome, Irada. Felix is in 500 level. He's also in Lagos. I think Lagos team, we are topping. We are topping, guys. We are more of Lagosians here. Okay. All right, guys. Let's dive into it. Before we start, I would like you to, again, share in the chat box. Let us know your expectations for today's training. At the end of this training, I mean, you are sacrificing 2 hours of your time. You are dedicating. I'm sorry, Oluwaremilekun. Okay, Oluwaremilekun is also here. Welcome. It's nice to have you on the call. Thanks for joining us. All right. Let us know your expectations for today's training. 1, 2 expectations. You can type it in the chat box. You know, you're dedicating 2 hours of your time, and we want to be sure we are meeting your expectations at least to a reasonable extent. So let's know, what do you want to know from the training? Stephanie, you have my slides, right? You can help me change to the next slide so they'll see that yes, it's time to drop our expectations. Yes, what are your expectations for today's webinar? Let's read it in the chat box. Then we want this session to be very interactive. We want to see a lot of interactions on the chat box. Understand we are students, so when I want to check in with you, I want to be sure you're following me. I can say something like ULADS. When you hear me say ULADS, just type in the chat box, what's up? That way I'll know you are following. So ULADS, you say what's up. Okay, Mustafa wants to learn what it takes to apply soft skills to be a much better healthcare professional who gives the best service to his clients or patients. Okay. Who else has expectations? Mustafa is interested in learning how to apply the soft skills to be a better dentist, to be the best, and to give good care to his patients. All right, guys, it seems it's only Mustafa that came anticipating, that came with an expectation today. The rest of us just said, oh, let me show up. After all, there is ASU strike. Is that so? Okay, thank you, Akingbade. After this webinar, I hope to develop my soft skills. This will help in my interpersonal relationship with my colleagues and patients. Thank you. Thanks for sharing, Akingbade Oluwatosin. Your expectation is you're similar to, okay. Olani Tori also said is open to learn how to apply soft skills both at work and also in other aspects of life. Oluwarem Leko is open-minded, is ready to learn everything we have for you today. Okay, that's beautiful. So from what I've read, I understand that our expectations are similar. We all want to learn about soft skills and how to apply them in our working relationships, in providing care to our patients and to our lives generally. So I'll start with this question: what are soft skills? I know it's a buzzword now everywhere. Soft skills, soft skills, soft skills, soft skills, soft skills. Like Mustafa said in the introduction, research has shown that getting a job and staying on your job requires 85% soft skills. So what are these soft skills? How do we define soft skills? When you hear the word soft skills, what comes to mind? You can use the chat box, and if you want to speak, you can raise your hand and one of our hosts will give you the opportunity to speak. What are soft skills? Come on, guys, we are 26 on this call. Thank you, Funsho, for breaking the ice. Funsho said soft skills are the interpersonal attributes someone needs to succeed in the workplace. Thank you. I like the word interpersonal attributes. Can we hear from more people? Please feel free to share. We are all students, right? And we are learning from each other. So there are no right or wrong answers. All right, let's dive into it. Thank you again, Funsho. Funsho has said it all. Soft skills are interpersonal skills. They are attributes. Okay, thank you, Akingbade. Akingbade said they are character traits and interpersonal skills that characterize a person's relationship with other people. So soft skills, they are people-centered skills. it's all about building relationship. There are behavioral skills that will help you work well with other people. It will help you develop your career. It will help you get hired and succeed in your job, right? So it's not enough to know all the hard skills. Soft skills are equally important. Now, recruiters weigh soft skills as high as they weigh the hard skills. So you may be the best dentist, the best dental nurse, you may just be the best professional, but if you're lacking in those interpersonal skills, yes, hard skills may get you the job, but for you to navigate the workplace complexities, to climb up your career level, for you to interact well with your patients and deliver the best care to them per time, soft skills are equally important. So now, can we differentiate between soft skills and hard skills? We've heard, okay, soft skills, soft skills, soft skills. What are the differences? How do we differentiate between soft skills and hard skills? Like I said, hard skills, they are those technical things you can learn. You're in medical school, for example, you're in dental school, for example, your degree as a dentist is an hard skill, right? Proficiency in a foreign language. You can put it on your CV that, yes, I can speak 32 different Nigerian languages. I can speak French, I can speak Spanish, German, only me. That is a hard skill. Those are hard skills. Your typing skills, if you like, you can type 1 billion words in a second. Those are hard skills. I'm able to operate this machine. I'm a dentist, and the best technology you can think of, I can use it. Those are hard skills. But when we talk about soft skills, we are looking at people-centered skills, relationship skills, your communication, your flexibility, your adaptability to change, your teamwork. Are you a good team player? Your time management. And that is the reason we are here today, to talk about these hard skills, to talk about these soft skills. And we'll also be telling you practical steps with which we can build upon these soft skills. You know, what we've discovered over time training young people on soft skills is that, okay, soft skills, they can be intentionally learned. You may not start off as being perfect, but by being consistent and being intentional about your growth, you begin to see that, yes, I'm communicating better. My learning agility has changed. I'm not a good leader. I'm not a good team player. I now know how to collaborate and cooperate with others. So next slide, Stephanie, let's understand why soft skills are needed for dentists. You know, it's no news to us that people are afraid to visit their dentists. Me, for one, I only visited my dentist just once. That happened, like, say, 2 months ago. Okay, can you mute, please? If you want to speak, you can raise up your hand. We'll have time for questions. Okay, yeah, sorry about the interaction, the distraction. I think it has been taken care of. So we are always afraid to go to dentists. People have, they have different stories, maybe from childhood memories. They just believe that visiting the dentist is associated with pain. There's this thing called the white collar phobia. So people are afraid to visit their doctors. They are afraid to visit, to go for their checkup, right? So when they come to you, it is your duty to make them feel comfortable. It's your duty to make them want to come back for their follow-up visits. And you do that with your soft skills. Now, if you look at the amount of work you put into studying dentist, to becoming a dentist, you know, I was having a chat with Eunice this afternoon, and I asked her, she said, you study for 6 years. 6 years of your life is dedicated to studying this course, and then think about the ASU strike. You budget like maybe 2-3 years for ASU strike. You put in a lot of work, a lot of studying, a lot of resources just to be that professional you've always dreamt of becoming. And you've gathered all the hard skill. imagine that simply because of your communication skills or your lack of teamwork spirit, you are not able to climb and attain the peak of your career. I believe we do not want it to be that way, and that's why your association has put up this training at this time. You know, being good on paper isn't always enough. It's important to consider the soft skills that will make you a great employee. Some of you are in your final years, you'll be graduating soon and you start working, right? So it's important that you develop all these soft skills at a time like this. And that is why this training is here. So we already know why soft skills for healthcare professionals, right? So I want us to just state in the chat box the hard skills needed for a dentist. Let me know you are following. Let's do a quick class activity. What are the hard skills needed for a dentist? Write all your medical jargons. Write the name of the procedure, that procedure where they wash your teeth, the one where they will replace a broken tooth and all of that. Let's know what it's called. So let's be sure if you're following, type what's up in the chat box. ULADS extraction. Okay, Mustafa said it's called extraction. Is it the cleaning that is called extraction or the replacement of a broken? What's up? Okay, scaling and polishing. I guess that's the cleaning part. I had that 2 months ago. Scaling and polishing. Okay, so I'll stop calling it cleaning. Scaling and polishing, teeth whitening. Thank you, guys. All right, that means we are following. All the scaling and extraction, the teeth whitening, all those ones, they are what? They are art skills. They are art skills. So it's important that we develop the soft skills that are needed for us to grow in our professional. And now we'll be looking at 5 most important soft skills for dentists. There are a lot of soft skills, right? But we decided to focus on just few of them that we feel will be beneficial to you at this time. So guys, the first one on our list is effective communication. Effective communication. ULADS, let me see your WhatsApp in the chat box. Let me know I'm not talking to myself. ULADS. Thank you, Akingbade. Who else is following? Can I see your WhatsApp in the chat box? Adetola is following. We are over 20 on this call. At least let's see up to 10 WhatsApp. So thank you, African Farmer Stories. Interesting name. Adebayo, what's up? Thank you, ULADS. It means we are following. So when we talk about effective communication, whether you're a dentist or you're a farmer, every professional, you must know how to speak to the people you relate with professionally. You must know how to speak to patients in a professional way, because you'll be discussing their medical history with them. You'll be telling them you want to. Where's the? Please, can you help us take care of the distraction? Okay, thank you. So like I was saying, you'll be speaking to your patients. You may be speaking to their families, explaining the meaning of the procedure to them. And you have to speak in a language they understand. These people are not doctors, right? They are not dentists. So how do you communicate to them in a way that they can trust you and find you credible? If you come across as someone that do not love to communicate, or you do not like people, it will be hard for your patients to trust you and trust your credibility. So the importance of communication skills cannot be overemphasized. You know, there's this movie I used to see on Netflix. It's a series. what's it called again? When help me with the name in the chat box. This autistic is a doctor, is autistic, right? He has autism.
Good doctor.
And Dr. Murphy, Dr. Sean, right? The good doctor, yeah, the good doctor, exactly. You know, Dr. Sean will just come and he'll tell a patient with that his American accent, you're dying, you're gonna die. If we don't take you to surgery, you'll die in 2 hours. Come on. And you notice, I think I saw the movie up to season 3. Every time they have to communicate with the patient or the family, they will always send the Black American doctor, this lady, Dr. Claire. The team will send her, go and speak to the family. And you see this lady, she'll go, she'll sit down and she'll be like, I know how you feel. I understand you couldn't sleep last night. It's because of blah, 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 blah. That's the reason you feel this way. But this is the surgery. It has so percent success. These are the likely complications and all of that. And you see that with for a patient that has refused to give consent initially, they will now give consent and they'll go ahead with the procedure. Why? Because of our communication skills. So we should learn how to communicate every day. You need to talk to people. You as a doctor, you have to review their histories with them. You have to ask them different communication, to ask them different questions. I beg your pardon. Again, communication is broad. Yes, like very broad. Effective communication is about taking a message from the sender, right, to the receiver. And for that communication to be complete, there must be a feedback, back and forth, blah, blah, blah. There must be a what? Feedback. Sometimes, if you're following, type feedback in the chat box. ULADS, what's up? Are we still on the call? Thank you, guys. Thank you, guys. So there must be a feedback. For a communication to be complete, there must be a feedback. Sometimes the feedback is not always verbal. When people nod front and back, it means they are nodding in affirmation. They agree with what you're saying. But when you look at people and they nod sideways, left and right, it means, no, I don't agree. So when you communicate with your colleagues, your patients, whoever it is, please look out for feedback. Because until the message is delivered, received, and understood, there is no communication cannot be said to have happened. Now, there's something we talk about. Your message should be clear, concise, concrete, correct, coherent, complete, and cautious. We call them the 7 C's of effective communication. Someone help me type in the chat box, clear. Clear, concise, concrete. Thank you. Correct, coherent, complete, and cautious. Thank you, guys. I can see you are following. So this, for your communication to be complete, these 7 C's have to be present. If you are talking, and you don't address your patients with some level of respect, then the communication, I beg your pardon. Let me answer the call. Sorry, I call interrupted. Then your communication is not complete, right? According to the Albert Mehrabian communication model, we always refer to him as the standard for communication. He said in his model that our communication is just 7% of our words. So as I'm here on this call, it's just what I'm saying carries just 7%. 38% is the tone of our voice, our modulations, our pauses, and a whooping 55% goes to our body movements, our face arms. So when you're saying something, you can be saying something with your words, but your attitude is saying something else. Like I'm asking you, hey, Eunice, can you help me share my slide? And she said, sure, I can. But our body language is just saying she can't. So our communication is 7% our words, 38% the tone of our voice, our modulations, our pauses, and 55% our body movements. So we will be conscious of this when we communicate with our patients. And we know for us to communicate properly, we must develop another skill called active listening. Active listening is under communication. ULADS, tell me what's up. Active listening goes beyond hearing. It's a mental process. It involves using the whole of you. You're hearing, you're seeing, you are interpreting, you are paying attention, you are flowing in the conversation. And for you to be listening actively is that you're summarizing to the person, oh, you said so, so, and so, just as you're telling me what's up. You're paraphrasing, you're asking clarifying question. You're asking, okay, what do you mean when you say this? That way your patients will feel heard. They'll feel like, yes, this dentist is actually interested in me. He's not just interested in what I'm paying for the service. Your body language is also showing genuine interest. And when you have to give feedback, you may not have to always give, you have to give feedback always, at least to your patients. You tell them, okay, this is the procedure we carried out and it was successful, blah, blah, blah. But again, with giving feedback, especially to when we find ourselves in a condition when we find ourselves as the superior, most of us will graduate and very soon we'll start practicing. We'll probably be leading a team of nurses, of technicians, and we have to constantly give feedback to these people. How do you give, although we'll still talk about teamwork and leadership skills much later in this webinar, but how you give feedback to people. Who is that? How you give feedback? How you give feedback? What was I saying? How you give feedback is important to how people perceive it. So there's the feedback, the sandwich model, where we advise that you start with a praise, then a corrective feedback or your criticism, and you end it with a phrase. So this is a sandwich. Below, you are starting with a praise. Oh, Omani, you did very well with this, and this. These are the strategies you employed that worked. However, I noticed that you weren't blah, 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 blah. Again, overall, you did well. Now, you started with a praise, then a constructive feedback, and you ended it up with a praise again. Do we understand the feedback strategy? If you understand, tell me what you start with in the chat box. Praise, thank you guys. So you start with the praise, then a constructive feedback, and then you end with a praise. Finally, I thought to talk about email etiquette. It's still part of effective communication. We are professionals. We graduate and we start working in clinics, and we understand that in the corporate world, we communicate more via emails. Is that correct? Is that correct? Why do you think we are always sending emails at work? Tell me in the chat box, why do we always send mails? Why? Why don't we just call people and pass information? Why do we always send mails? Why do you think your boss is always sending you mails? You're always sending mails to your team lead. You're sending mails between departments. Thank you, Olani Tori, for easier communication. Thank you. With sending mails, you can communicate to millions of people per time. All you have to do is to copy them in the mail and they get it in real time, right? So it's important that we obey some email etiquette. Again, for documentation, you can always refer back to the mail. If someone is denying that you send someone a message and person is a lie, you know, send me. You just go back to that mail and then you write on it and you copy your boss and say, okay, please, can you see the time I sent the mail, something like that. So while sending mails, it's also a good communication that you go straight to the point. Dear Agbabiaka, I hope this finds you well, blah, 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 blah. Kindly find attached the minutes of our last meeting. Best regards. Go straight to the point. Always reread your message and check for errors. For me, I always use Grammarly. You know, Grammarly is free. It will help you correct your grammar and some misuse of words. Avoid shortcuts. Yeah, I thought to say this because these are Gen Z. These are generation. We like writing with shortcuts, but it doesn't show you a good professional. Stop copying unrelated recipients. Some people will just go and copy all. and you copy people that are not even interested in the mail, right? Mention your attachment in the mail. When you have an attachment, let them know that, yes, kindly find attached so and so, so they'll know what to look up for at the end of your mail. With all these are steps that can help us communicate effectively. There are some clinics too, especially fertility clinics. The doctors have to send mails to their patients back to back. They have to tell them to, I don't know if dentists do it, they have to tell them their results, tell them how to review their cases, let them know their next appointment. And as doctors, healthcare workers generally, as dentists, it's important that we imbibe all these communication etiquette so that our patients will have to come back to us and they'll not say, oh, I'm changing my clinic, I'm not satisfied with my consult with Lagbaja Hospital. Now we'll talk about emotional intelligence. If you're ready for emotional intelligence, let me know in the chat box. Type ready if you're ready. Okay, we have two people ready. Okay. All right, guys, I hope you're learning one or two things. I hope you're not just bored. I hope you're getting impact. Are you learning something? Israel said ikuzo. I don't know what that means, but thank you. All right, when we hear the word emotional intelligence, what comes to mind? What do we understand by emotional intelligence? Two words coming together. This, our class, we are very quiet too. Emotional intelligence. What does it mean to us? Thank you, Irada. Thank you. Emotional intelligence is all about managing our emotions and managing the emotions of others. Is our ability to recognize, to interpret and process emotions in ourselves and others, not just ourselves. You're managing yourself and you're managing others at the same time. And the reason why this topic is important is because we are dental students. We are dentists in training, right? But we've been studying this course for, say, 6 years plus ASU strike. And for most of us, we do not have emotional learning incorporated into our curriculum. So we see professionals that understand the core of their job. They understand all the art skills, but they do not understand their emotions. They do not know how to relieve stress. They do not know how to show empathy. They do not know how to diffuse challenge. They are just there struggling with life and all of that. Again, research has shown that as human beings, we go through up to 25 different emotions in an hour. So within 1 hour, one person has felt happy, he has felt pain, he has felt disappointed. Different kind of emotions, because we are emotional beings. And within a day, you've gone through up to 400 emotions. So it's important that you recognize your own emotions and you use it while relating with others. As healthcare professionals, we cannot downplay the importance of empathy while treating our patients, right? So there are some competencies of an emotionally intelligent person. We have empathy, self-awareness, motivation, self-discipline. Those are the competencies of emotional intelligence. Emotional intelligence begins with self-awareness. It's about knowing yourself. How well do you know yourself? Yes, you can say, yes, I know myself, but how well do you know yourself? Have you ever been intentional about learning about yourself? There's something called a personal retreat. You go on a personal retreat where you think about yourself. So self-awareness is all about understanding your behaviors, your motives, understanding your emotions, understanding your triggers, understanding that your emotions impact both yourself and your neighbors. it impacts those around you, whether for better or for worse. And when you understand this, you are able to behave in the best possible ways. Self-awareness comes from the internal self-awareness, which is what I've just explained, and the external self-awareness. And a combination of the internal and the external self-awareness makes for a truly self-aware person. External self-awareness means Eunice is speaking to Mustafa. Mustafa, what do you think about so? What do you think about? Asking a mentor, asking a friend, a family to help you uncover your blind spot. For those of you that drive, some days you'll be reversing and you just go and jam something because it was in your blind spot. But external self-awareness means talking to your fellow dentist and asking them to help you, to tell you about yourself, tell you about your best, your weaknesses, your strengths, even though you've gone on a personal retreat. And this is you combining what you've heard from these trusted people with what you know about yourself and using it for your best to be a better person. Another component of ULADS, tell me what's up. Another component is self-regulation. Is about controlling yourself, understanding your triggers and control it. Think of those situations and where you are likely to express emotions in a bad way and control yourself. I recommend, what is it called again? Oyinkansola Alabi, the popular Oyinkansola Alabi, the emotions doctor. You know, in her book, The Soul Stripper, she talked about the 6-second pause, where she advised that before you react in a difficult situation, in an annoying situation, take 6 seconds to pause. That way, when you react, you'll be reacting in a manner that is in proportion to the given situation. You won't overreact. So it's important as professionals, especially when you deal with people that are vulnerable, you are dealing with patients, that you react don't be like Makanaki, you react in a proportion that is suitable with the given situation. Again, social skills, that's about networking, building relationships. This may not always come in handy with your patients, but building relationship with people at work, with people you come across in your everyday life, knowing how to communicate clearly, maintaining eye contact when you talk to them. You know, you do not want to come across as that person that only shows up when you need help from people. You also show up when it's time to help people. That's how you build relationship. That's how you network. Empathy. This is the core of a healthcare professional. You should, most times as doctors, as dentists, you're treating situations that you've never experienced, right? Some of you've never lost a tooth, but here you're treating a patient that has a missing tooth. How can you walk in their shoes, even when you've not felt exactly what they are feeling? How can you feel their pain and respond to them in a professional way that makes them know that, yes, I feel what you feel? And to show empathy is a great soft skill, not only for a healthcare professional. Everywhere you find yourself, it requires a lot of patience, listening to people, let them feel heard, pick up on emotional cues, let them know you are interested in them. And finally, motivation is another competence for emotional intelligence. It simply means motivate yourself. Don't wait for our society to motivate you. If you look around you, you find a million reasons to be demotivated, right? But understanding what you want for yourself professionally and individually and working towards those goals, that is what motivation. Let your motivation be intrinsic. Let it not be dependent on your external environments. So the conclusion of this whole story on emotional intelligence is that never act impulsively, especially as you're dealing with vulnerable people, dealing with patients. Take a step back when you are upset. Understand what you're feeling. Understand the consequences of your action. Then proceed accordingly. ULADS, we're rounding up in a short moment from now. Leadership and teamwork with this. Thank you, Omoni. Are we still following? Thank you, guys. We decided to merge the both of them together because as dentists, you hardly work alone, right? Most times when you're practicing, you practice with other people. You are working as a team. And in a team, you always have a leader. We saw Buchi, which is in the scenario that you've been sharing all week, right? It's important that you, or Kachirada, it's important that you know how to position yourself as a leader. And being a leader means you should show empathy. Your emotional intelligence should be on this level. As dentists, you're working in a team. You're a leader. How do you motivate your team members so they stay inspired all through? Also, you're working in a team. Are you a good team player? Are you a team player that would just be lazy? Please let me know if this example resonates with you. Like you're in school and the lecturer gives an assignment, it's a group work, and he says, everyone, you score the same thing. You do a presentation and you find yourself in a group where nobody is doing anything. They are just waiting for one person to do the whole work. And you know that you are in that group, or if you don't do the whole work, you all fail, and you don't want to fail. Because of that, you are tasked with doing all the responsibility. That was my story in my undergraduate days. I was always in teams where the team members are lazy and they are not just interested, and I have to do the whole work. So you do not want to come across, this resonates with Chima, you do not want to come across as that team member that won't pull their weight, that will just leave the work for just a segment of the team to deal with it all. Then as a leader, avoid claiming all the credit for a job done. Celebrate other people's win. Praise team members publicly and generously. Do it well. That way you are sure that your team members stay motivated, right? Personal effectiveness. We thought to add this to it because we are still students, and building the skill of personal effectiveness now that we are still studying will help us when we start working full-time as professionals. ULADS. Personal effectiveness is just about giving your best at all time. Every time you find yourself at work, in school, make sure you are not doing your job with mediocrity. Make sure you are giving your best. Make sure this person patients want to see. It's a skill that can be learned like every other soft skill. It is a skill that can be learned. I beg your pardon. And how do you become an effective person? Number one is that you take ownership, take responsibility. Don't just take the credit when there's success, and when there's failure, you shift blame and say, it's Lagbaja that caused it too. Wherever when you're in that position, take responsibility, manage yourself with the understanding that yes, success is possible and I want success. Take full responsibility for your results. When it's time to execute a project, do not be the one that is procrastinating and saying, I'll do it tomorrow. Be all about execution. There are some people that while you are still thinking of the idea and rationalizing, this thing will work like this. Will this work? They are outside executing already and getting results. Again, be disciplined. That's one important skill for personal effectiveness. Create the mental, when you create discipline in one specific aspect of your life, you are able to transfer that mental toughness to other aspects of your life. As students now, if you create the discipline of studying from the beginning of the semester, you don't wait till it's exam time. You create the discipline of doing your assignment, your homeworks at the right time, preparing for your exams at the right time. You won't be under pressure, right? Learning agility, be open-minded. That's one thing that makes for personally effective professional. They are open to learning, unlearning, and relearning. Some of you are just saying, thank God, though, I'm in 600 level now. When I graduate, even signboard, I no go read. Is that correct? You've not started, though. You've not started. keep learning, because in the medical profession, every day there are advances, technology, things are changing. So if you feel like, okay, I've learned this, how to use this machine, so I won't learn the new ones. One day you just wake up and you see that you are cake. You are already back to the Stone Age. Your mates have moved, they've moved forward, they've moved on, but you've refused to improve yourself. And finally, time management. Time management, right? ULADS, what's up? Thank you. Finally, we are talking about time management. As students, let's begin to manage our time now. So when we start working, it won't be difficult to manage our time. Learn to plan your day ahead. You can use what works for you. Is it a diary? Is it sticky notes? Again, say no to people when you have to say no. All those time wasters, learn to say no to them. Recognize that obstacles, yes, obstacles may show up, and plan ahead of your time, plan for them. Learn to do the things that are important and that are urgent. Delegate those things that you know that, yes, they are important, but they are not urgent. Learn to delay gratification. Delay those things that are time wasters. And some things, they are not important and they are not urgent. They'll just delete it, because you have to learn how to manage your your time properly now that you're still in school. Because I tell you, working as a dentist or as a healthcare worker generally, time will always be a challenge, because every day you have to see, some doctors see up to 50 patients in a day. So if you've not learned how to manage your time now, learning it then becomes stressful. It's important that we be good time management, do important things, delay those things that are important that are not urgent, delete all those things that are not important and they are not urgent. Learn to delay gratification. And there's this soft skill that I thought about. I didn't include it in the slides. Finally, as healthcare workers, please take care of yourself. Take care of what? Yourself. Please, if you're still with me, let me know in the chat box. Take care of yourself. It's common now to the word physician burnout, where doctors are constantly caring for others and not caring for themselves. As a dentist, you are always cleaning other people's teeth, but you are not doing that for yourself. You are checking other people's BP, but you are not checking yourself. And we are now hearing about physician burnout. Doctors are tired. Some of them are slumping. It's a soft skill. And it's important that you cannot give what you don't have. You only take care of people when you are healthy. So it's important that you begin to prioritize yourself, and please type "take care of yourself" in the chat box. It's probably the most important. Take care of what? Yourself. Thank you, guys. So thanks for listening. We'll stop here for today.
Thank you so much, Mrs. Peace Fabunmi. Come on, I think we should give another round of applause. Like every sentence that Mrs. Peace Fabunmi shared with us was a gem. Was a gem. I mean, so thank you very much. Thank you very much, Mrs. Peace Fabunmi. Hello. So yes, ULADites, this has been a very, very power-packed session. It has been filled with gems. Literally every statement was something to hold on to. So if you have questions, if you have any questions, we'll be able to take only 2 questions. If you have any questions, please signify in the chat box or raise a hand if you have any questions. Do we have any questions? I think till 4:58 will be given time frame. Do you have any questions? Or do you want to, what did you learn? For me, take care of yourself. That was one thing that struck. Take care of yourself, learn to motivate your team, but motivate yourself too, to learn, unlearn, and relearn. So many gems, so many gems. So do we have any questions? Anything we want to clarify? something that probably you didn't hear properly? Do we have any questions? Okay. Well, I think I have a question. So, Mrs. Fabunmi, thank you very much for your time and everything, because there was so much I could hold on to. But I would like to ask, how does a professional, so if you're a professional, okay, you're a professional dentist already, and then you find out that you are quite deficient in some of these soft skills, how do you start learning? You are you're speaking to us now. This is a training for us to become better dental healthcare professionals, better people, and we are still quite more moldable. But then you're a professional. You've been practicing for 25 years now. You're a dentist, But then you find out that recently you seem to be lacking some of these soft skills. How do you start learning as a professional?
All right, thank you. Honestly, we are learning every day. Nobody is perfect. We are learning every day. So if you're 100 years old or you've been practicing for 100 years, you have you have all the accolades, you can still learn. It's about being intentional. And for you to know you are growing, you are maintaining a journal for empathy, for emotional intelligence. Like I said, recognize those situations like, okay, today I interacted with this patient and this was how I treated this patient. It wasn't fair. How can I react better in future situations? Think about it, make a note, keep a journal. In future, you may not encounter exactly the same situation, but you'll be conscious that, okay, I didn't speak well to this old patient. Can I be more patient with old patients? They require a lot of tender, loving care. How can I be more patient? It's all about being intentional. With communication too, you will always fall into the temptation of just talking. But can you talk and then pause a bit to watch the other person give their feedback? So all these soft skills, they can be learned. That's the good thing about it. It's just about being intentional. Yes, it will take time. Don't get discouraged when you see that, yes, you've not done very well. Keep learning. Keep what? Learning. Every day you get better. Provided you are intentional about your growth, you're putting in the hard work, you're self-aware, and you're looking out to be better, you keep growing. I hope that answers your question.
Absolutely. Thank you very much.
Thank you very much, Mrs. Fabunmi. Really appreciate your Thank you very much, Ma. I really appreciate everything that you told us. I think the time management really struck a chord with me, because he said we should delay things that are important but not urgent, and remove things that are not important and not urgent. Thank you very much, Ma. So we are moving on to the next speaker. Can everybody hear me, please?
Yes, loud and clear.
Yes, can hear you.
Okay, thank you very much. We are moving on to the next speaker, the person of Dr. Dorothy Umeh. Dr. Dorothy Umeh is a doctor in dental school. I haven't had the privilege to meet her yet, but let me give you a brief introduction. Dr. Dorothy Umeh is a renowned consultant orthodontist. She graduated from the University of Benin, Edo State, Nigeria, with a dental degree over 12 years ago. With the aim of self-improvement, she went for her postgraduate studies in orthodontics and dentofacial orthopedics with the Lagos University Teaching Hospital. She's a member of various academic and professional bodies, including National Postgraduate Medical College, where she's an associate fellow, the West African College of Surgeons, where she's a fellow, Medical and Dental Council of Nigeria, to mention a few. She is certified in clear aligner treatments, implants, self-ligating orthodontic treatments, and has a special interest in children and cosmetic dentistry. Her international and home-based experience have helped her relate well with clients' diverse needs. She's also currently working as a consultant orthodontist at Lagos University Teaching Hospital, Lagos. Thank you very much, Maria. I'm so privileged to have you here. We hope to learn so much from what you have for us today. Thank you. Can we give a round of applause for Dr. Umeh?
Hello. Good evening, everybody. Can you hear me? Can you hear me?
Yes.
Hello? Okay.
Yes, ma'am. Can you
Sorry, can you hear me?
Okay, that's fine. Thank you, everybody. I came in at some point during the first presentation, and I can say I quite thoroughly enjoyed myself. So I would, there are a lot of overlap in our presentations, but I want to give more clinical scenarios as to how soft skills relate to us as healthcare professionals. I will be going interchangeably between the dental practice and then our lives in general. I would really commend you because skills is something that is so big now, so big now, because hold on. I'm trying to get to share my slide. Try to share my slide. Let's do that. So it's something that is so big now, and gradually it's becoming very difficult for you to practice without having the soft skills. So the main objective, so before we start this lecture, there are all this this conversation or this discussion, there are some things we need to set objectives, which is very important. So this 30 minutes, 45 minutes that we're sitting down, not doing any other thing, what is it that we want to achieve? So basically, we're looking at 6 things. We want to understand the different types of skills you have. What is the difference between the two of them? What are soft skills? What are those ones that are relevant in healthcare practice? Why is it important really? How do you develop these skills? So most of us, we're all dentists, and gradually, or we're dental students, and gradually we're trying to, we're hoping that in a couple of years that we would, or a year or two, we're going to become dentists. I have to apologize for the long strike that we have had, how it has affected calendar, our academic calendar. The school
Ma,
is
please, we can't hear you.
You can't hear me?
The audio is bad, ma.
Oh dear. Okay, hold on. Hold on, let me see. Hold on, let me see what I can. Let me try and connect with another device, and then I'll mute this one. Just hold on 1 second. I will connect with another device. I should Okay, can you hear me now?
Yes, ma'am.
Okay, so I'm trying to take this volume down. Try and take this out. Okay. Oh dear. Okay. Hold on 1 second. Let me try and move let me share my screen from here so that it's easy. Hello, can you hear me?
Yes, now we can.
Okay.
Yes, ma'am.
So while I'm speaking, I'll try to get my screen to come up, even though it's not much of a lecture that requires a lot of the screen to come on, but I'll try to put that up. So I was saying that I want to apologize to you for the long strike that we have had and how much it has affected your academic calendar. Unfortunately, I wish there's something I could do about it, because the school is practically quiet and practically quiet without you. And we have to say we really miss you. So very importantly, we were talking about the importance of that for this, if we're going to spend our 30 minutes, 45 minutes here, we need to have objectives as to the reason why we're here. One of them is, what are soft skills? What are the different types of soft skills? Okay, what are the different types of soft skills? Different types of skills. What are the different types of soft skills we have? Which ones are relevant to the healthcare practitioner? Why is it really important? Can't I practice my dentistry without having soft skills? And then the last but not the least is, if I don't have them, how do I develop them? That's a very big question. If I don't have soft skills, what do I do? Must I have them? If I don't have them, how do I develop them? So those are basically the reason why we are here today. And as a way of introduction, really, I would say that with the increasing competition in the healthcare sector, some couple of years ago, there were practically maybe 2 dental schools, graduating maybe 10 students. Everybody was sure they were going to get a good job. And in fact, there was a lot of space and we were waiting to be filled. But now with an increasing labor force, it's becoming today, interestingly, the medical and dental education is so big, such that it's really big, but then do you have enough job opportunities that will fit your dreams after going to dental school? 6 years, some of you 7 years, some people 8 years with the COVID and the strike. So gradually, with increasing competition in all the sectors, including the health sector, there is intense pressure to excel and distinguish yourself from the large workforce. And today, interestingly, the dental education is insufficient to attract the kind of job opportunity you desire. So no matter if you're the best graduating student, you know all the angles, class 1, skeletal pattern 1, malocclusion, you know how to cut the best class 2 cavities, you know everything. Without the soft skills, it's almost impossible for you to land that kind of job or for you to excel the way you would want to in your practice as a dentist. Today, I'm not talking to you as dental students because I know that for you to have come this far, I know that you have what it takes for you to graduate. The question is, after you have graduated and you have that degree, what do you do with it? How satisfied are you going to be practicing? How satisfied would your employer be to say that, oh, Umeh or INA is a perfect dentist? The establishment cannot afford to do without her. What are you going to do? What are the qualities you would possess to make your patients say that I'm going to drive from Ikeja to Awoyaya to go and see Dr. Ayeni or to go and see Dr. Mustafa? Those are the little things, those are the soft skills, and they are the things that differentiate you from every other person. And that is what we're going to be discussing today. And as patients' expectation of the doctor goes far beyond the treatment of the disease, it simply means that for the patients that come to you for care, they are not coming to you only for you to treat their disease. Their expectation of you is going far beyond the fact that they are going to come to you and then you treat them. So going through that, you understand the reason why we're going to soft skills. So there are two major types of skills. You have the hard skills, and then you have the soft skills. The two skills are very important. You cannot do, as much as we're focusing our attention today on the soft skills, the hard skills are also very important. And in the health care sector, there is an appropriate level of focus on the hard skills. And the competency in these skills are regularly assessed, and most providers will have very little difficulty in assessing these skills and assessing your competence. If a dentist sits before me today and they say, is this person qualified to have this job? Assess the hard skills. It's going to be easy for me to say, okay, Dr. Ayeni, I'll give you a model. Can you cut a class 2 cavity for me? Or give me the steps involved in A. A patient comes to you, can you clerk and draw up a treatment plan? It's very easy because that is what we learn in school. That is what we learn in school. So it is it's easy, and it's usually quite objective for us to sit down and assess the hard skills. So when you're talking of the difference between the hard and the soft skills, the difference is quite pronounced, and we can always tell them. And historically, the emphasis have been on the development of the hard or the clinical skills. So in the practice of dentistry, of medicine, or in the management of healthcare, there is a lot of emphasis on the hard skills because those are the things you need to treat your patient. But the question is, when you treat those patients with the hard skills alone and the patient is fine and the soft skills are missing, is your patient satisfied? The answer is no. You as a person, would you be satisfied? The answer is no. The people working with you, would they be satisfied? The answer is no. So the soft skills, however, are the ones that are observed by the families, the patients, and the people who work with you. So most of the time you treat a patient, the patient is fine. What remains in their minds long after they have left you are your soft skills. You treat the patient is fine. But what happens to what's the experience the patient has? What experience do the people working with you have as they go with you? So most patients and families are unable to truly assess a provider's hard or clinical skills. So it will be their perception of the strength of your soft skills that will drive how they rate you in your clinical expertise, which means that soft skills can also be an essential element in providing healthcare, patient satisfaction, and happiness in the workplace. So the hard skills basically are the technical skills. You get them from your academic knowledge. You're trained to have them. You have practical exposures. You go to the clinic, you get them. You know, they are the occupational requirements of a person to develop those skill sets and perform a certain type of task. So for the hard skills for you, it is what you have been doing since you entered dentistry in 100 level. And you're still on it now. And you still have probably a year or two before you finish. So in the healthcare, there's an appropriate level of focus on the hard skills. Competency in these skills is regularly assessed, and most providers have little difficulty in being able to assess the competence. They are usually quite easy to define and measure. For instance, if I sit you down and say, oh, what kind of malocclusion does the person have? You can tell me. You can tell me a patient has mouth ulcers. This is the way I'm going to treat. This is the way I'll manage facial fractures. I can tell whether you're telling the truth, whether you're boboing me, or whether you know what to do. But the question is, how am I sure that you're going to be able to do it well, leaving the patient satisfied, you are happy, the people working with you satisfied? That is where soft skills come in. So with my presentation, I know the first presenter has done a lot of the clinical, of the theoretical work. I'm going to be pushing in a lot of clinical scenarios as to what a doctor will do that will qualify to be sufficient clinical skills and what is not sufficient. So very quickly, the soft skills can be termed is a sociological term relating a person's emotional intelligence quotient. The cluster of personality traits, you can call them social graces. They are peculiar to just you. Your habits, your friendliness, your optimism that characterizes your relationship with the patients or with your colleagues, or even the way you relate with yourself. So you can call them social graces. They do not necessarily have anything with the way you cut a class 2 cavity. It does not have anything particularly with the way you will manage your fracture. So it's an individual's attitude, your strengths, your qualities, your personal actions that make you able to execute your duties or practice dentistry in a way that is acceptable to the patient, to yourself, and to your colleagues at work. So yes, both the soft and hard skills are important, but very importantly today, we're paying a lot of attention to the soft skills. So people who aspire to compete professionally not only need the academic and technical skills, but also the soft skills to meet the organizational goals. Soft skills are quite valued very strongly these days in all the sectors around the globe. Wherever you want to find yourself, are you remaining in dentistry? For some of you that say, well, after dentistry, I don't want to do dentistry, I just want to go into politics. I want to go into business. I want to go into administration or something else. Wherever you find yourself in every sphere of life, even if you decide not to work, in your relationship with people day to day, your soft skills come very important. And the lack of those soft skills can be a serious obstacle for a person's career and development. And a considerable number of people do not achieve their career goals because of inadequate soft skills. I need us to pay a lot of, you see this statement, take it with you, write it somewhere, look at it every day. If you cannot develop your soft skills, look at it every day. A considerable number of people are not reaching their career goals today because of inadequate soft skills. If you do not have adequate soft skills, there is no magic you will do. You will not be able to open all the doors available to you, and you will not be able to reach the peak of your career goals. For every sector you find yourself, the career, the soft skills you need would vary depending on where you find yourself, okay? So soft skills work in tandem with hard skills, especially in medical practice, to improve a person's interpersonal relationship, their job results, and their career opportunities. So you have the perfect soft skills, you do not have hard skills, it cannot work. You have the hard skills, you do not have the soft skills, you cannot work. So while the technical skills can get you into a job, for instance, if I assess you, if you come into a job and I'm sitting at the table as the MD, and they say, Dr. Umeh, please, can you employ a dentist for us? I'm going to sit down and listen to you, ask you some questions, ask you to do some clinical procedures. And I say, oh, Dr. Abiola is fantastic, let's employ him. It will get you into the door, but the interpersonal skills it will get you into the house. So you get the job, but the interpersonal relationship and your soft skills will open the majority of the doors for you and will move you up the ladder. Okay, will move you up the ladder. So now, having said all this as my introduction, I would like to say that the main objective today is to focus on the skills that are relevant to us. I don't want to go into all the classification of the soft skills. They can be classified into the personal, the social, and the methodological. I believe the first presenter would have done a good chunk of that. Hello, are we here? I hope we're following. Hello?
Yes, ma'am.
Yeah, okay. Are we following without the slides, or do you want me to take 2 minutes and present the slides? Can you follow me?
Yes, we're following without the slide, ma'am.
Okay, that's fine, because basically it's not supposed to be, why I'm not bothering to struggle to put up the slides is, it's not supposed to be, it's not like an academic session. It's supposed to be, let's just talk about ourselves. How can we make ourselves better? So having gone past the classifications, I want to take you to some very important soft skills if you're going to excel as a dentist. I'm not talking to you today as students, you're all going to graduate. When you graduate, and when I talk to you about these skills, I want you from today to begin to practice it in everything you do, because for everything you do, you have to practice it, you have to get better. There are 10 skills that will make you that are very important to you. One of them is communication. 2 is empathy. 3 is your professionalism and your strong work ethics. I will take a bit of time to go through all of them. Your ability to work in a team, an ability to take criticisms, being able to lead, leadership skills, self-confidence, its ability to manage your time, stress management and adaptability. I'm rushing through them so that you don't get bored, because I know the last presenter went through them. Critical thinking and problem solving. And then the last but not the least, I put a couple of things into it. I put in humility, honesty, integrity, and respect. So we go through communication, empathy, professionalism and strong work ethics, teamwork, an ability to take criticisms, leadership skills, self-confidence, ability to manage your time, stress management and adaptability, critical thinking and problem solving. And then the last but not the least, I go with humility, honesty, integrity, and self-respect. So what is communication? Everybody is saying this: communication, communication, communication. What are you saying? So communication is considered the most, for a good number of people, and for me personally, I feel is the most important soft skill. Most of the soft skills revolve around it. Quite a good number of them, most of them revolve around it. And it refers, most people would define communication as the impacting, or it refers to the impacting or exchange of information. Did you hear the word exchange of information? You are not just talking, it's the exchange of information by either speaking, writing, and use of other media.
It could be verbal, that is when you're talking, or it could be nonverbal. So you're not only communicating when you're talking. So it's the exchange of information. You have to be exchanging the information, not talking alone. By speaking, by writing, and by the use of media, by other medium. It means that the prescription you write to your patient is communication. You don't jaga it and say that is the way a doctor's writing is. You're not communicating. And then you tell the person, take it to the pharmacist, he will understand what I'm saying. So communication can be verbal and it can be non-verbal. It is very critical in the workplace. So you sit in a workplace. What are you saying to your colleagues, to the doctors, to the nurses, to the cleaner, to the security man at the gate? Then you go down to your patients, their relatives. Every single person, the way you communicate, I have to say, when you communicate, when you see your classmates and you tell your classmates hi, or your friend or a fellow doctor in a workplace, you see the patient, the person, your classmate say, hey, hi, good. How was your day? How was your weekend? Oh, it's a Monday. Then you see a patient, an elderly man sitting at the reception, and you say, hi, hello, and then you walk past. The person probably wouldn't respond. So you're talking to the person, but are you really communicating? What you're saying at that particular time, is it right? And the ability to communicate with your patients. Listen, be observant, and respond to patients' need. Empathize and understand and carry out your consultation in an organized and professional manner are considered the basic requirements of a competent health practitioner. So no matter what you know, no matter what you can do, the ability to communicate with your patients, listen to them, be observant, respond to their needs, empathize, and carry out your consultation in an organized and professional manner is what is considered as the basic requirement. If you don't have that, you haven't started. Because you have to listen to me as a patient, know my needs before you decide what to do for me and to me, before I know whether you can even do it. So the patient sits down. What are you saying to them? Let's even start basically, because communication is very big. I'll spend a little time on it. You come to work in the morning. The security man is at the gate. Hello, how are you? It starts with that. Oh, good morning, sir. How was your weekend? Your communication has started. You're working with your team. Remember that the person that is coming into your establishment, if you're running whatever establishment it is, will go past the security man first before he comes to you as the doctor. Let me use the dental school as an example. You come in and you see the cleaners are coming early in the morning. They have come in before you to try to clean the place where you're going to work. And you don't even say, good morning. How was your weekend? Are you okay? You're not communicating. How do you think the person is going to feel good? The person you're working with, the nurse, you have told the nurse, please kindly set up for me to see this patient. And the nurse has set up and is missing one instrument right in front of the patient. You turn to the nurse. What's wrong with you? Did I not tell you to set up this? This is what you do every time. You have said, you have communicated, but was it right? No. Has the person listened to you? No. What you have done is that you have incited bile in that person. The person is grumpy. The person is not going to be an effective assistant to you, and you will not achieve your aim. So you have said something, but have you said it right? No. Which takes me to what you need to do when you come to communication. When you're communicating, there are certain things that are key. What you say, how you say it, when you say it, and to whom you're saying it to. Very important. What are you saying? Who are you saying it to? How are you saying it? And when are you saying it? So a patient comes to you. Let's go to the patient management, for instance. A patient comes to you and has caries. Let's use things that are very common, that has caries. And you turn to the patient after examining, assuming you've done everything. After examining, you turn around and tell the patient, you have a lot of holes, so we have to fill it. And then, okay, fill it. Have you communicated? Maybe yes, maybe no. All the patient knows is that, okay, the doctor says I have holes. Some people that know book, the very intelligent ones will tell you, you have caries, sir. You need to go to restorative department to restore those teeth. And if you don't restore those teeth, you can end up with Ludwig's angina. That is one of the sequelae of dental caries. Was he in class with you in dental school? How do you expect him to understand what you're saying? He's going to go home and say, I met this dentist that was just speaking spree for me. But you see, the man comes in, a typical scenario. Good morning, sir. So why are you here? Another important aspect of it, you learn to listen. You don't go paternalistic. When you're talking to your patient, understand they have come to tell you something. If they knew what to do, they won't come to you. And you are not a magician. You cannot know what the patient wants without the patient telling you. What brings you, sir? You might examine the patient and see a lot of holes. I've had patients that came in, a lot of cavities, and the patient was just interested in whitening. You see, at that point, you can examine the patient. You have holes. The patient will tell you, no, I want to whiten my teeth. Now communication starts. You have to educate the patient. And when you educate the patient in communication, you must say things the patient can understand. You must be able to discern the educational level of the patient, the understanding, your language. Do I need to get someone to translate? Does this patient even understand English properly? Do I need to get in somebody that understands Hausa or Yoruba or Igbo to make sure that this patient can understand fully what I am saying? Is there a need probably to even though the patient starts on my chair first, I'm trying to meet procedures, especially what we're doing in school now as dental students, we want to meet procedures. Would this patient be better managed if another doctor who speaks Yoruba fluently, if a patient sits on my chair and doesn't understand English or Igbo, sits on my chair for treatment, the only Yoruba I understand is Elanu and Ekpanude. Finish. So all I can tell the patient is Elanu, the patient opens, Ekpanude. I'm not even sure which is which. How am I going to effectively communicate with that patient? When you're communicating, make sure your information is complete. Break it down in simple English. Let the patient understand, oh, sir, you have a hole in your mouth. Do you know the way holes occur? You have a lot of bacteria in your mouth. When you take a lot of sugary substances and you do not brush and take them out very quickly, the bacteria in your mouth will act on those on those sugars. And the way we have byproducts, or after eating food, we excrete in the form of urine and pooing, for instance, that those bacteria all their byproducts are acidic, and it is those acids that melt your teeth. So if you take sugary things and you don't take them off in time, those bacteria in your mouth will act on them and produce things that will now melt your teeth. So your teeth are, when you have holes in your mouth, is because your teeth are melting because of what because of the products the bacteria have produced. Most people will understand that later. But you have caries. And if you don't feel them, you can have a lot of consequences. There are some, in some rare cases, the infection can even track down to the throat and can even kill. And you have many of them. You see, you're passing across an information. You are educating the patient. Not you have holes. You have holes. We need to fill them. Or I want to send you to the restorative department for the restoration of all your carious lesions. If you don't treat it, you are saying the same thing. Is the person understanding you? No. Sometimes in communicating, I want to go from what you're saying, how you're saying it, when you are saying it. There might be some vital information that you may need to pass across to a patient without the other person being around. Oh, sir, or even how you say it, sir, the patient might come for something else. Sir, I can notice some bad breath. Have you ever noticed it? You're saying the same thing as sir, your mouth is smelling. The same thing. Would the patient perceive it the same way? The answer is no. So very important, what you're saying, how you're saying it, when you're saying it, and to whom you're saying it is very important. There's some information that you should pass, especially, for instance, when I say to whom you're saying it, when it comes to caring for the child, when a child patient presents, for instance, you have a lot of information to pass to the child. You also have a lot of information to pass to the caregiver. If you talk to the child alone and just treat the patient will go home, come back maybe in another year with maybe 20 curious lesions. All the teeth are curious. So you need to know what you're saying, to whom you're saying it, how you're saying it. Okay, so that is very important. When you talk to your colleagues at work, please talk to them with respect. Whether they are your juniors or your seniors, you must address them in a way that shows that one, they understand you. If you are the head of your team and you know a lot of book, you are very intelligent, please communicate to the cleaner, communicate to the new nurse, communicate to the intern, to the house officer. When you're giving instructions, make sure your instructions are clear, so that people don't misunderstand you and do the wrong things. Communication, very important. The majority of the unintended mistakes that we make in healthcare is caused by a breakdown in the communication of the caregiver. Very important. You need to note this. Studies have shown that a majority of the medical or dental mistakes are caused by a breakdown in the communication by the health caregiver. When it comes to communication again, make sure your information is adequate. Do not give half-baked information to your patient because you feel that the patient will not agree to do it again. That comes especially when maybe you have graduated, you're in practice, a patient has come to you and you're suggesting tooth whitening for the patient. Make sure you communicate effectively. Have you told the patient the consequences? Have you told the patient some of the side effects involved in what you're doing? Is the patient going to have sensitivity? Tell the patient, let the patient make an informed decision as to what the patient is going to do. The patient comes to you to do braces of orthodontic treatment because you want this patient to pay you 1 million naira. You do not tell the patient the inconveniences that come with wearing braces. You do not tell the patient before the patient starts the treatment. You must tell the patient. It's not when you've slapped the braces onto the patient's teeth that you now tell the patient, after you've got braces on, there's some information you need to know. You cannot eat hard foods. You cannot eat nuts. You cannot do this. You cannot do this. You should have given that information, which is why I said when to say it. You are passing the same information, but are you passing it at the right time? Inform the patient before the patient gets onto that procedure. Let the patient decide that they want to go ahead with it. That is very important. It is not when the patient is done, a patient comes and you tell the patient, look, if you wear braces for 2 years, your teeth will be nice and complete. You do not tell the patient that that patient is going to wear retainers afterwards. Communication is very important. So, nonverbal communication. When you're saying these things, how are you saying it? Nonverbal communication. A simple smile when you come in, your patient comes in, can make the patient feel relaxed. These days, with the advent of mobile phones, you don't want to make the patient seem like you're not interested in what they are saying. Sometimes the patient is talking and you're like, hey, I'm listening to you. You're pressing your phone, you're chatting, you're trying to quickly send a message. Some of those things make the patient feel like they are not important. You need to look at that. You must learn to listen. Look, maintain eye contact, nod. Make the patient feel like they are the center of what you are doing. Don't stand and tower over the patient. So that the patient, you need to sit down, you should sit at the same level, maintain eye contact, and be interested in what the patient is saying. 2, empathy. I'm not going to dwell a lot on this. I feel the other presenter did a good job on it. You need to show some empathy. When you treat somebody, a patient, every patient is an individual. Show some empathy, okay? Every patient is an individual and not a disease. And I think most of those things start in dental school. When you're hustling for the procedures, I have a class 2. You have a patient. You don't have a class 2. This is my class 2 patient. All you're interested in that patient is the class 2. Whether there are other things that are important to this patient, you can see that patient seeming like the patient is depressed, having a meltdown. You don't care. You just want the patient to open the mouth and you do the class 2. Whether the patient is in pain, discomfort, you don't care. All you want to do is treat the patient, collect your money if you're in private practice, or sign your procedure and go. From today, please, some empathy in the management of your patient. Professionalism and ethics, very important. It is the core of the medical profession. You must be professional in what you do. Sometimes you need to accept the fact that there are some things as a doctor you cannot do. There are places you cannot go. There are, no matter, you must comport yourself in a certain kind of way. You need to look at the cultural setting that we are in. For instance, coming to work, there is a certain kind of way you cannot dress. It will affect the way your patient perceives you and indirectly affect the way will affect your service delivery to the patient. Make sure you do no harm in the management of your patient. If you cannot do the patient any good, make sure you do no harm. I have had a patient come to me, malocclusion, nice. Came to this doctor. The doctor was not an orthodontist, couldn't arrange the teeth. Got into the orthodontic treatment. When the doctor couldn't arrange the teeth, the doctor proceeded to start trimming the patient's teeth. By the time the patient came to me, the patient had teeth looking like small cubes. Are you professional? Absolutely not. Are you ethical in what you're doing? What you're doing, is it right? Is it every patient? You need to understand when a case is gone past your level of competence, seek help, refer. It is very, very, very important. Okay. And then lifelong learning, very importantly, you cannot survive in healthcare industry if you do not continue to learn. You must invest in yourself as a practitioner. Things are moving, medicine, science is evolving every day. You must dedicate yourself to making sure you learn every day. You must update your knowledge, both theoretically, practically. You must attend conferences, you must attend seminars, and you must attend workshops, and make sure that the care you're giving to your patient is the best available at that time. Simply an ability to take criticisms. Ayeni comes into the clinic and the nurse on duty reminds Dr. Ayeni that, Ma, you just come in and you're about to start seeing the patient and you didn't wash your hands. Dr. Ayeni takes it personal. Who are you to tell me what to do? Because she's a nurse, and in hierarchy, a doctor is more than the nurse. A younger colleague sees what you're doing and even suggests to you that, oh, Ma, instead of treating this patient this way, can we consider this? And you feel that you are too big. I'm giving you this because you're going to evolve in practice. If you're going to make practice effectively, you must understand that you alone as the doctor cannot treat the patient. The nurse is important. The cleaner is important. The orderly is important. Your colleagues are important, both the junior and colleague, and together you will give your patient the best of care. Nobody knows everything. You must be open. In fact, sometimes openly ask people, what do you think? What is your idea? What do we think we should do? If you feel you have a group of people who are so scared of you that they will not say anything in front of you, that takes us to the next step. It means that you are not managing your team very well. Your leadership skill is lacking. People need to be comfortable with you to be able to make suggestions. And when people make those suggestions, you must be willing to take them. Okay? You must be willing to take them. So when it comes to leadership as well, leadership can be defined as the action of leading a group of people. There is no place where leadership can be more important because the lives of people are in your hands. You must lead by example. If you're the head of a group, or even if you're not the head of a group, you must understand that you're a leader from wherever you are. People are looking up to you. Even in your class, there are people in your class that are looking up to you. You must learn to do the right things. Learn to serve if you are going to lead. Effective leadership style is required to move the profession ahead and never stop at your own achievements. Be always willing to change and learn to solve problems innovatively. Time management is very important. This is, I think, we need to begin to change that mindset. It is a culture we have cultivated. We need to stop it. We come, you give the patients an 8 o'clock appointment. You saunter in at 9:30. You walk past the patient. You do not even apologize for coming late. You know you have booked 10 patients for a clinic that is supposed to last 3 hours. You sit and you know if you do that, you know that you cannot give the patient every patient more than 20 minutes. You have done probably a histopathology. You are going to disclose to a patient that he or she has cancer and you want to do it in 10 minutes. You're going to lose your empathy. You're going to not give the patient adequate time. You're going to rush through your consultation. Your patient is not going to be satisfied. You're going to eventually do the work. You're going to tell the patient has oral carcinoma. We're going to book you for surgery. You're not going to have time to sit down, empathize with that patient, manage the patient's emotions, and effectively deal with all your activities for the day. You will understand that if you're going to, it even starts with what you do the day before. You know you have a surgery the next morning as an oral surgeon, and you party all night. Could that party have waited? Yes. Or you wake up in the morning and you're on the phone with somebody only to realize it's 5 minutes to your clinic time. Then you wake up, you rush in, you don't comb your hair, you come in looking scruffy with an unironed word coat. The next thing is that your patients are going to look at you. You're going to look scruffy from the time you come in. You're not going to be comported. You're not going to give it your best. You're not going to deliver your services effectively. At the end of the day, you have done the work. The hard skills are there, but the soft skills are lacking. Adaptability, you as a doctor, remember you're treating human beings. Your work schedules will have to alter once in a while. You're not going to say, oh, I treat my patient once it's 4 o'clock. I've had to work with a doctor that's a patient, 2 siblings came for scaling and polishing. The doctor did the scaling and polishing for the first one, and the nurse was setting up for the second one. And because it was past the patient's closing time, the patient didn't tell the nurse anything, walked in, packed his bag, and and through the door. It's your closing time yet, but you were going, that patient has been in and has been waiting for you. Courtesy. You can adjust your closing time a bit to satisfy that patient. The person that is taking over from you on call is ill. They just calls you. You must be ready to make some adjustments. You, as a medical personnel, you may have adjustments in your shifts and in your duties. Critical thinking is very important. Ability to synthesize information and be able to bring up a treatment plan, the best for the patient during a period of time. Okay. You cannot tell the patient that comes to you that, oh, I'll think about it, go and come back in 2 weeks. Okay. Then other things that are important is honesty. You must be sincere to your patients. Very sincere to your patients. You must tell them the truth at all times, whether it will hurt them or whether they are going to like it. Integrity is very important. Most patients will come to a doctor because they know this doctor has integrity, and you must respect other people. So you see, all the things we are talking about, they are not really, if you look at them, will they affect your ability to treat a patient from start to finish? When you're looking at the hard skills, maybe not. But you're not treating a robot. You're treating a human being that has emotions, that can see, that can feel. So you must incorporate all these things if your patient is going to be satisfied with you. So soft skills are important because that is what the patients can see. That's what the patients can see. Sometimes, unfortunately, the doctor a lot of people will tell you, oh, I can't practice my soft skills most of the time because we just work in a hectic environment. But unfortunately, it is in situations like that that your soft skills are most important and they come to play. Soft skills enhance communication. They strengthen collaborations within the team, as well as provide a welcoming, efficient staff for our most important audience, which are our patients. The combination of our technical expertise and soft skill is very important for patient management and even for business management. Okay? Soft skills are very important in helping manage and navigate the challenges in the work team and provide patient satisfaction. We've talked through the soft skills. The question now is, how do we develop these soft skills? What if we don't have it? We cannot have it all because nobody is complete. But in the way you study to become a doctor and develop your hard skills, you must effectively study as well to develop your soft skills. You must go for your workshops. You must attend personality development programs, compulsorily. Development workshops and programs on the dental team. Rewarding network building and collaboration, very important. Watching materials that will help you and attending seminars, very important. You must develop your oration skills, okay? And mixing and adjusting with all kinds of people. As dentists, I come into the clinic. Let me give you a typical scenario. You see the way I am at this presentation, and I can have my hair long this way. Dr. Umeh walks in to the clinic on a Thursday to run clinic with my hair dangling this way, with a tight and clingy outfit, and I'm chewing gum away. And then I say, I know I'm 30 minutes late. I don't care. And I'm just chewing my gum. And I say, are you ready for the clinic? Please put the patients on the chair. I have walked past all the patients that have been waiting. And then I sit down and I don't even greet the patient. Ma, please, can you open your mouth? Or sometimes you don't even say anything. You just pick up the probe. And the patient automatically understands that because you have held up the instrument for examining, that he should open her mouth. And the patient opens the mouth. And you finish examining. And you just turn to the doctor beside you and say, what do you think the treatment for this patient is? You are just talking to yourself. You haven't put the patient into perspective. Even in the course of managing that patient, my long hair is moving into the patient's mouth, and I want to show and I just keep going in the managing of that patient. Is it wrong for you to have long hair? No. But could you have managed yourself? So in your soft skills, you have failed. You didn't greet your patient. You didn't apologize to the patients that you have kept waiting. There are 1 or 2 times that circumstances beyond your control keeps you waiting, makes you come late. The minute you sit down, the first thing you should say is, good morning. Please, I sincerely apologize for coming late. And then the patient understands that, oh, okay, Dr. Umeh understands that they have kept me waiting. And then you go, why are you here today, ma'am? The patient tells you, please, if you don't mind, can I have a look at your mouth? Then you look. And then you look at if you have other people working with you. Have you seen the patient? Okay, what do you think? Well, and then you discuss. And then when you finish discussing, you must turn back to the patient after you have talked in all your verbose terms to explain to the patient in simple terms what you are saying. As a dentist, I will not say a dental student, you must begin to pay attention to your soft skills. Pay a lot of attention to your communication. Start today. If you have a roommate, learn how to communicate with them. Manage your emotions. It is not everything the patient tells you that you will react to. Not because the patient told me, I will call people to slap you. And then all of a sudden you just wake up and say, if you slap me, I will slap you back. I have said that happen a lot of times. Did you have to respond? Even start with, I'm sorry, madam, please don't be upset, even when you're right. And then in the course of everything, the patient may in turn come back to say, I am sorry for the way I have spoken to you. I sincerely apologize. Remember that if you're going to effectively thrive, imagine that you graduate and you run a practice. It is the soft skills, your hard skills, one, that will make the patient stay with you. But the hard skills will make the patient, your soft skills will make the patients keep coming back. I have a doctor who called me recently. I see the doctor privately. The doctor called me recently and said, doctor, what is it that I can do to improve? My patient flow is dropping. The first thing I told the doctor was, your receptionist is terrible. Your nurse, but I didn't say that before the doctor asked me. But he's a colleague and I could sincerely tell him the truth. When I come in to see your nurse, she doesn't smile. The first thing she tells me is, ma, remove your shoe, climb on the scale. And then she peeps, come and sit down, let me check your blood pressure. That nurse, each time she does that, I remind myself that I'm older than this lady. She couldn't even say thank you, good morning. And there was a day she was seeing me, a man was coming in, holding himself. You could see that he was in a lot of pain. And I turned around and I said, ma, please, that man seems like he's in some pain. And he said, madam, please stretch out your hand. And I said, didn't you hear me? That man is in pain. I said, madam, if you're not ready, you go and sit down. It was a private setting, but it made me feel like I was in a government setting. But even that statement is wrong, because whether private or public setting, it is wrong. And I told the man, I can't come back to you. I can only come back to you because you're a personal friend. That's why I keep coming. But a lot of people, and he said, I've spoken to a lot of people, and they told me that they're never coming back because your staff are not good. They don't treat me well. The man himself is good. The doctor himself is good, but the soft skills that is lacking in his staff have chased all his clients away. No matter how good you are as a dentist, no matter how skilled you are, you need to take this away with you. If you do not treat your patients right, if you have elderly patients sit down on your chair, you are going to treat them. You know what to do. It doesn't change the fact that they are your elders. You greet them first. First, you show respect. Then you listen to them. Then you're professional in what you do. Make sure you do no harm. Be ethical in it. Communicate properly. And lead properly. And make sure that in everything you do, most doctors are the head of the team. Lead appropriately. I will conclude by saying that as effective as important as your hard skills are as doctors, please remember that without your soft skills, you are going to practice wherever you are. You are going to be in business. Dental practice is a calling. It's not a job. It's a career that has a human face to it. You're treating human beings. Money will not give you everything. Don't, in chasing for money, compromise your integrity. Don't, in chasing money, forget your ethics, your professionalism, because the patients might not tell you. But on the long run, the most successful are those whose soft skills are intact. Develop your hard skills as a dentist, but today, tell yourself that you're going to work hard to make sure that your soft skills are intact. So at this note, I will say a very big thank you to you for listening to me. And at this point, I will stop and entertain your questions. Okay, I will stop and entertain your questions. Thank you very much.
Thank you so much, Ma. Thank you so much. Let me start by saying that we miss you too, Ma. We can't wait to come back to school. We can't wait to start school again. Thank you very much, Ma.
Absolutely.
And I'm sure I'm not just speaking for myself when I say we thoroughly enjoyed this session. Thank you, Ma. Thank you for giving us so many tips going into the corporate world. There have been so many take-homes from this, which was our prayer. So I just want to quickly ask if anybody has a question, you can type it into the chat box or raise a hand. Does anybody have a question?
Good evening.
Good evening.
Good evening.
Thank you very much, Ma, for your presentation. Ma, when you were talking about how we can develop our soft skills, you said it's necessary for us to attend workshops and programs that would help us gain those soft skills. What kind of workshops did you mean?
There are a lot. So the thing about it is, if you go online, okay, there are a couple of those workshops that come on all the time. Even on things like I tell people, when you're surfing the net, remember primarily that you're not an entertainer. I tell doctors that, remember you're a dentist. You must actively surf for things, that will improve you as a person. When you go to social media and you look for motivational speakers, you will find them. Follow them. When you follow some of those key people, when they have programs, they will put it on their platform. Just the same way when it comes to orthodontics, I follow quite a significant number of orthodontists that are good. And one good thing about social media is, especially the Instagram, is when you search something, over time, they give you things related to that. So you search something on I'll try to send one or two people to you that you can follow. Even if you go online and you search seminars on soft skills, you will find it. Things related to it, actively search for those programs. If you actively search for them, you will find them and attend. Once in a while, even if it's not in your field. For instance, when I prepared my slide today, I had expected that I was going to be addressing both some medical and some dental. So if you're searching actively today, for instance, I would have expected some medical people to be on this platform. It will help. So at workshops, just the same way you got me to speak, different groups will have other people who are speaking and try to develop them. You can find something on communication. If you follow different people in different spheres, it doesn't necessarily have to be within dentistry. It can be outside dentistry completely. It can be in the media space. I've had to attend something on media before, just because I wanted to listen to the person speak. I heard the person is a fantastic orator. And I said, let me go and listen to this person speak. Power in public speaking. There are books, buy the books, read them. If you go online, you can download some of them if you don't want to buy them and read them. At some point, I wanted to understand emotional intelligence. I went and bought 4 books on emotional intelligence and I read them. I took time and I read them. I read books on leadership. So for each of these skills, you need to even sit down and appraise yourself. Be sincere with yourself. Ask people who stay with you to appraise you. Even be open enough. If you feel people who are with you are not open enough, give them something that will make them anonymous and actually ask them. And then be sincere with yourself. If you know that you're the person who has hurt them, tell yourself the truth. Even when you tell yourself, I haven't spoken, when you speak, think before you talk. Some basic things, attend seminars, read books, attend workshops and all. And I think it's a gradual thing, and then you will learn. but I'll try to send you 1 or 2 people you can follow. I'll suggest 1 or 2 books you can read, because it's something that is evolving every day. It's something you have to keep working on. It's not a one-day thing. Okay.
Thank you very much.
Thank you, Ma. Thank you very much, Ma. Edwin was raising his hand. Can I ask you a question?
All right, good evening, everybody. Good evening, Ma. I am
Good
so happy
evening.
to be here. Thank you for the whole lecture so far. And I must say something. I love your gesture. You did it in such a way that I was glued to my screen. I was not distracted. I just love the way you were demonstrating with your hair, your hands, and everything. Thank you very much, Ma, for the lecture. Okay, to my question. I just want to talk on patients who most times I have interacted with a lot of patients. So some of the things I get from them, I am not too satisfied with it. Some patient comes to the clinic with this entitlement mentality, like I have paid for this whole thing. So like you are, I don't know how to the word to use now. Like they have that feeling that they can order you around. Like I've seen one, like the way the guy acted. So I was just like, why do you, is it because you feel you have money, or so they just want to, how do you now relate with that kind of patient? Do you now follow their own tune, or you just, some patients are just there to just make you go crazy. Like, I don't know if you've had experience with those ones too. So how do you relate with them? Ma? Thank you.
Okay, that's a very good question. So sometimes I always say, if you have it at the back of your mind that 2 people in every disagreement, there are always 2 sides to the story, or 3 sides to the story. The side, how do they say it? The 2 people's perspectives and the truth. Many times before the patients come to you, sometimes they're already disgruntled. For instance, I was at a meeting typically today where they were talking about reshuffling payments, the modality of patients' payment. And they said, okay, the patient will go to up the one dental building to pay and come down to the UBA room to collect the materials and then come back to you for treatment. You need to understand that there are emotions, just like the other speaker said, before a patient sits to you, they have experienced a lot of emotions before they came to you. They're experiencing some currently as they are sitting with you. You need to manage the individual. It might be more of the patient being irritated than having an entitlement mentality. That is 1. Then 2, if you have the mindset that you're there to serve, it changes your mindset a bit. The truth about it is, the way especially we treat patients when they are in the public sector is different from the way you would treat them in the private sector. Maybe sometimes because you're not translating the patient care directly to the food on your table. And so that is where the hard skills come in. When a patient sits down, 1, which is what I have cases like that. I ask myself, is anything irritating this patient? So the first thing I will do is greet you. Courtesy, you see. Are you okay, sir? Or are you okay, ma? I don't even understand. The way I came in, they did not even do something that, please just treat me, let me be going. That is also where professionalism comes in. If you are very professional, the number of such cases you will have will significantly reduce. I've had cases where I saw a doctor, a patient, that day, in fact, I just didn't want to be part of the system. The doctor came, moved from the patient, came to the other patient and sat down and was like, hey, madam. And the patient told the doctor, please go and wash your hands. You see that? The patient is reminding you that you haven't practiced your infection control. Some may not say it, but they will be irritated. So you need to understand that sometimes when the patient comes to you, they feel entitled, because the truth about it is, especially in the LUT setting, many of us are very detached from the care of the patients. You need to understand that this patient came in the morning, waited 1 hour for the person who is registering to come. The person came, sat down, and said, oh, I've been in traffic since 6 o'clock. All of you will wait until I eat. Then you register. Then the patient comes in. If you are in that patient's shoes, you're going to say, please, doctor, treat me. Let me go home. It's your duty to treat me. But you see, you can actually clean up all that mess that has come before if you're very professional and you have your skills, your soft skills are top notch. Oh, you don't seem to be in a very good mood. Is everything okay? Oh, your face doesn't look too good. Are you all right? And then it's at that point you realize that your possibly not the primary cause. It might be, if the patient is coming to you on a new day, it might be the bad experience the patient had the day before. So you need to manage all that. But that aside, you're going to have patients that are like that will remind you that they are richer than you are. So they come in with an air. Just maintain professionalism, which is one part of it that I forgot to mention in my presentation, is self-confidence. You see it. You must wear it on your shoulders. I'm not saying you should be proud, but you see, when you walk in, I will tell everybody, I am small. But when I walk into the clinic and I talk, you will know that, okay, this person knows what she's saying. Which is why each time I complain, the students coming in 100 level, they are very confident. They are very chatty, very happy. By the time they are getting into 400, the tone of their voices begin to go down. They begin to lose their confidence. And I ask you, what is killing your confidence? As a doctor, you need it. The patients can perceive a doctor that is not confident from a mile. When you sit in, even your posture, the way you sit, the way you present yourself, you don't want to come in looking scruffy. The patient shouldn't be able to assess. Luckily, we have what goes, we have scrubs. The patient shouldn't be able to tell whether you're rich or poor. And when you talk, you must talk confidently so that you gain the patient. If the patient doesn't trust you, or you haven't been able to convince the patient, or you do not exude confidence, the patient will treat you anyhow. So you have a lot of soft skills. It's a combination of everything. But aside that, there are people who also have bad soft skills lacking and they are bad mannered. You also learn to manage soft people. So I'm sorry, ma, except it comes to a situation where you feel that your life is being threatened. I've had a situation where a woman was having orthodontic treatment for her son. And each time she comes, doctor, come and treat me. I want to go. Doctor, come and treat me. And sometimes, yes, there are things I cannot control. And after a while, I said, ma, would you mind if I transfer you to another person? If you feel dissatisfied with my care. No, it's not that I'm not satisfied, but please. And each time she comes, she's shouting from, after a while, she came someday, I was treating the son, and she was towering over me. The son kept shouting, Mom, you're embarrassing me. Even the son was embarrassed. Kept shouting, you're embarrassing me. And she was towering over me like she was going to beat me, and she was very big. The only thing I said was, sorry, ma'am. And then I turned to the nurse and I said, please, could you kindly help me get the security? Ma, I just had to get up. And when I finished, I told the mom that, please, ma, I think that for me to treat you, you need to respect me and I need to respect you. If there are things I'm doing that you do not like, please kindly tell me. But I think at this point, I'm emotionally traumatized. I don't think I can continue with the treatment of your son. I would kindly speak with the consultant. I was a resident in training that time to transfer your treatment to another person. At that point, the woman calmed down. And she said, ma, in fact, after that, we became best of friends. And I realized she had so many home issues bothering her. So I probably was the weakest. It was easy for her to vent on me. It was easy for her to vent on me. But at some point, you need to know when, not being firm particularly, but you need to know when to kind of exert yourself or assert yourself and know when. It's a combination of everything. It's manage the patients properly, bring your soft skill in place. You need to look confident. You need to know what you're saying. You need to know how to carry yourself. You need to know what you're doing as well. So it's a combination of everything. But the patients with the entitlement mentality, sometimes I think most of the time from experience, we need to learn to exude a lot more confidence. Carry ourselves properly. Don't look scruffy. And I think pretty much that's it. I hope I've been able to answer a bit of your question a bit.
Yes, ma. Thank you very much,
ma'am.
ma.
Grateful. Thank you very much. Thank you, ma'am.
So we are very pressed for time, but we've learned so much. We've learned so much from this session, ma. And I hope that we're going to change the lingo and we will start saying that we have a patient. We don't have a class too. Thank you. Thank you very much. But we have one last question, and this is from a series of scenarios that we created before we started the Zoom meeting in anticipation of the soft skill webinar. So this is about Bimpe. Bimpe is a dental student. She's a beautiful and easygoing student. She's the typical I can't kill myself type of student. She just crossed over to the College of Medicine. However, she wants to join all the associations and groups in school. She also joined 2 units in her Christian fellowship. She runs a food business during the weekends. What advice do you have for Bimpe? How can she balance all of them since she just crossed?
That's very typical. I tell many students, you are not, when you come to school, you're primarily a student, you're not a pastor. You cannot, there's a maximum that you can do as a student. There are some things Bimpe needs to understand that she is one individual. And coming to school, you have one primary assignment. You're going to have to pass your examination. You're going to have to learn the skill of dentistry. You cannot do everything. If a food business, so I will tell Bimpe, if a food business, if you're sponsoring yourself through school, I may not completely ask you to give up your food business. I will ask you to pick your food business, shed some associations, and then your academics. But you also need to understand that if you have, that dentistry you have a lot of work to do. So if you're going to keep up, you can't leave. You need your food business for you to be able to survive in school, so you need that. But then you need to study hard enough. You need to have to compensate for that by reading more. You can't have side times or idle times when you sit down idly and you're chatting. You can't. Associations you're in. Bimpe is not managing her time very well. Bimpe lacks time management and need to apportion, consider that there are some things that are important and there are some things that are necessary. And you can't always do everything at the same time. If Bimpe wants to be a pastor, for instance, Bimpe can hold on, pray privately in her room, attend fellowships once in a while, and consider pastoring as a full-time job when she graduates, or consider leaving dental school and facing pastoring. But you can't do everything at the same time. Bimpe will have to shed some load. Yeah. Thank you.
Thank you very much, Ma. I personally found this very inspiring. I'm sure everybody else has found this very inspiring. We are very honored to have you in our midst. Thank you so much, Ma. So I'm going to hand over to my co-host, Mustafa, as we close this session.
Pardon?
No, absolutely. We are rounding up already, Ma, so I'll be handing the closing prayer. Thank you very much, Ma, for your presence, for the gems you shared with us. Thank you so much, Ma. So in the name of Allah, the most gracious, most merciful, it has obviously been a power-packed and enlightening and, of course, enjoyable session too. We pray that everything that has been shared with us sticks with us throughout our stay as dental students and as we grow to become better healthcare professionals. But most importantly, I hope we pray that it makes us better individuals. Even though this has become quite a cliche with all our issues in Nigeria, we pray that we place this 5-month-long strike action in the hands of God, and we ask for a definitive solution and that it comes to an end as soon as possible. We also pray for the safety and guidance of everyone here and every dental student and every lecturer and everyone in College of Medicine, University of Lagos, and the excos of ULADS who have put this together. May God continue to be with us. And we thank you very much for your participation, everyone. Thank you very much. Thank you so much. Exalted be Allah. the Lord of might above whatever is described. May his peace and blessings be upon the messengers. All praises to God, the Lord of the worlds. Thank you very much, everyone.
Thank you. Thank you.